today, we'll just start with general navigation login. We're going to go through a couple things, including opening an encounter, accessing the bedboard, opening a client's note, adding a current med and allergy, setting up a standing order, and then dispensing a med. So we're going to focus on those things. Please use the chat. I think there's only 2 of you that I see, Danielle and Matt. So any questions that you have that are important to you, just let me know. So what we're going to do is we're just going to log in. I'll go a little quicker today. If you guys want me to slow down, let me know. I'll assume, you all know the yellow button and the login by now. So we'll put our usernames and password in. Left-hand side is going to be all your daily functions of navigation. So if I want to start in the bedboard, I'll go to the bedboard. If I want to go into a chart, you will highlight a client. So if I want to find a patient, I can search for a patient. If I want to find a location, I can go to a certain location. If I want to search for a program, I could just go to all residential and hit search. I have 3 residential beds here. If I want to take John Woods and just go into his chart, all your functions are at the bottom, everything that you can do. So from the bedboard, I can either just open their dispensing to dispense a med directly from here, or I can go into their chart to maybe do a medical encounter, get their allergies, current meds, and I'm going to do that today. I'm going to do a UA screen and adding current meds and allergies and just opening encounters. So I'm going to show you a couple ways to do this. The first way is going to be open your database, go to the bedboard, find your patient, and then add notes by going into their chart. Okay. Now when the system opens, the all button is everything we've converted over from version 7. So these are all of your encounters. You'll see here we have medical encounters, medications. Whichever encounter, we kept all the names the same. I don't know each one of the users and which encounter they use because there's so many and you guys all use a lot. So if it's okay, I'm just going to open a medical encounter. And what it'll do is it'll open it. So I've already done one of these medical encounters, so you'll see it's a signed one. So what it does is it just shows you the last one. If you remember from our training, we always hit the blue plus sign here on the right-hand side to actually add a new encounter, okay? So I'm just going to open a new encounter. I'm not going to go into too much functionality of the timeline right now. I just want you guys to be able to open a chart, get into a note, and start a new encounter. Okay, so I'm going to look at both of these here. Let's see what we have for encounters. I just want to see what's in them. I can't use this guy. All the guys we converted from your current version, I can't use to put in new notes, all the test clients that are in here. Just have to find someone that I put into the bedboard. So let's try Chrissy Woods, because I think we put her in yesterday. So I'm going to go to the bedboard, find my patient, add notes. Okay, when I log in, I'll just go, for today, I'm just going to go to my All tab, click my medical encounter, and then what I'm going to do is hit the plus sign and open a new encounter. Okay, and what it does is it gives you a new encounter to do at the bottom. Now, I'm just going to minimize the top bar. I know a lot of our clients like to minimize the top tab just so you have more room on the screen. Just remember the top arrow at the top just cleans up the screen a little bit for you. You also can get rid of the timeline if you don't want it to make it bigger. I find this more important depending on what type of device you're on. If you're on a small screen, tablet, a lot of clients clean it up. If you're working on a monitor at a nursing station, a lot of people just leave them the same. I'm on a small 12-inch tablet, so it squishes everything a little bit. But I'm just going to move up the screen so you can see it. So all I've done, went to the bedboard, opened the encounter, picked a medication or medical encounter, opened it up so I can get some history on the client. Okay? So what you can do is go through your past medical history, do social and lifestyle, and every section basically has a little template behind it that you can open to fill out information. So I'm just going to do allergies and meds right now. So I'm going to open up the allergy and medications, and this links to the e-prescribing. And this is everything that this client is on, okay? I'm going to pretend they're a new client and just click the current medications. And once you open each section, all the buttons tell you exactly what you can do. Order med, add current med, add standing order. So you're just picking what you want to do. For today, we're just going to add a current med, and let's just do something like Zoloft or something. I don't think I have Zoloft on their account yet. And we'll do 1 time a day. 1 time per day. Okay. So very simple. Add a current med. If you want to add an allergy, open the allergy tab, select the allergy, severity of the allergy, and transfer it in. So all I'm doing is adding current meds into the patient's chart in the encounter, and I'm going to transfer that. The transfer button's pretty important because you can save them in the section. You have to transfer them in order to go into the note when you're done with the encounter. And I think from what I learned, you guys do all of your medications directly from an encounter. So you can do it from the timeline in the cloud, which is what I use a lot, but you can do it from any encounter that has allergies and meds that you currently use. You're going to use your same encounter, and you're going to add in current meds and allergies the same way. Now, in order to put those on a regimen, when is the patient supposed to get them, to set the timings, the set timings is going to be the little blue medication log on the right-hand side. So if I want to take that Zoloft, it's going to open up the e-prescribing application. I'm going to take the Zoloft, select set timings, and say, when do I want the patient to get it? Well, we'll say they need it in the morning after breakfast, and we'll start it. Let's start it today so it goes to the bedboard. 1 click over will be 30 days, and we'll hit save. And what it does is it creates my my dispensing board. It sends this patient over to the dispensing, so they'll show up on who needs a med today. Just adding a medication, all we did was click current meds in the encounter, and then it actually holds it in this current med button in this window so you can set the timings. You picked which medication you wanted, set the timings, and now it moves it over to the bedboard, or to the dispensing board, okay? And what we're doing is we're just doing that directly in the encounter here. So we open it up with the little blue pen. We see what we put in for current meds and allergies. This is what's going to go on the encounter. Then we come over to our medication log, select the Zoloft, put it on a timing. Now this time I'll transfer it. They're here. Close, transfer. Always just follow the bottom of the screen. The button at the bottom will either say execute or transfer. Just always select that. Now this Zoloft will be in the medication dispensing. That's going to be on the left-hand side from the home screen. I'll come back to that in a minute. Now, if I want to add a standing order, okay, I can scroll down through the encounters, but all of your standing orders are in your diagnosis section. So when I get to the bottom and I put in my ICD codes and select my standing orders, there's a button here called standing orders, and I'm just going to hit the plus sign. We've taken all your standing orders, and what you do is you select the standing order that you want and hit select all, and what it does is it moves all of them in. Now you can remove any that you're not going to give the patient for any reason. For this example, I'm just going to apply the whole order. Okay, and I'm going to hit add to list. So what this does is it took that standing order and added it into the client's chart. I'm going to say transfer this into my notes so the encounter is saved. And I'm going to go ahead and sign the note, okay? So when I'm done, I'll just say unsigned, let's sign it, and hit OK. Now what I need to do is just execute the order. Now I'm doing these separately just so you know the sections. Normally you just go through here, add current meds, add standing order, open up your medication log and execute all of them. But in this case, I'm showing you each section individually just so you can see it a couple times. So I have assigned encounter. Here's everything we put in the client's chart. And I'm just going to hit my medication log. I'm going to take the standing order because I had already put in the Zoloft earlier. I'm going to take the standing order and say, let's execute this. Okay? So do you see the standing order here? It's all set to PRN just like you have in your current system. And now we're going to say execute. The execute button is what says I'm ready to start administering these medications as needed. Send this to the dispensing board just like we did for the Zoloft. Okay? And then you always just follow the bottom icons on the bottom, which is just transfer. Now I have a signed note, I have current meds, I have diagnosis code, and I have my standing order. Now I'm going to go through one more time and do it again just a little bit faster without explaining each individual item, just to get used to the flow. So I'm going to go home, start my day, go to my bed manager. Okay, let's see if we can find a different client that I might have put in recently. Let's try Lori. I think she's a newer client. Let's do add notes. Hit my all button. I think we did the medical encounter. I don't remember if I did the medication or the medical. Let's see. Okay. All right. So I'm going to clean up my screen a little bit. Add our allergies and medications. We'll just do a current med this time. So we're going to add a current med. We'll add in, what does she have? So I'll do the Zoloft again. Okay, 25 milligrams, 1 time per day. Save. So I added in the Zoloft. Okay. If I want to do it from the right-hand navigation bar, I can just click the medication log. I also can add it directly from here, and it'll go into the note. So I can do Zoloft, same thing, 1 time per day. Either way, it's going to bring it up into my list if I do it in the encounter. I believe that's probably what you guys do today, or you just do it in the medication log in the timeline. Either way, it's going to bring this into the medication screen, and I'm just going to hit the set timings. Hit the plus sign. Let's give it at lunchtime, starting today. We'll say it's a 14-day supply, and transfer it. So it's set all my timings. Hit the transfer. Now, Lori C., this client, okay, should be in the bed board, or in the dispensing board. So we're just going to go check that to make sure all these clients are going over. So I would go back to my home screen. Home is your friend. It just brings you back to the beginning of the system to navigate where you want to go next. Now I'll go to my dispensing board. Okay. I'll see I have Lori C. and John Woods. I think those were the couple that I did. I'm going to take Lori C. It'll give me every medication she is prescribed to get. We're going to do the Zoloft, giving it at 12 o'clock. We'll say the patient missed the dose this time, and we'll just hit save and exit. Okay? So now what happens is it goes to the dispensing and it puts it to an X. All right? Just going to go home. We'll do it one more time, just for repetitiveness. So I'm going to go to the bed board. We'll take the same client, just because I know that one works in your system. Let's see if this one works. Elizabeth Woods. I think I put them in. I think they're new. Add notes. Hit the all button. Click the medical encounter. Hit the plus sign. She's not at a location yet, so let's just put her in a location. See if I can use her or not. If they're copied over from your database, I can't open charts. So if they were a migration name in the training part here, I can't do clinical notes on them. So I'm just trying to see if any of these I can open as a test client. No. Let's go back home. We'll stick with Lori because I know I can use her. All right, let's find Lori. So we'll pick Lori, add notes. Open the Alt tab. This time I'll just do the medication encounter. Okay. It'll always show you everything that's been done. Now we already have some, so it's holding some current meds. But what I'll just do in patient just admitted and feeling sick. Okay. So I put a note in. Then I'm going to add current allergies and meds. We'll just do a current med. We'll say Tylenol for pain, they kick right in. 500 milligrams 3 times per day. Save. Okay, so the Tylenol is there. So now what I need to do is just put that onto the dispensing board. So we'll transfer it. The note's done. We'll sign the note. And then we'll go ahead and execute that Tylenol so it goes to the dispensing board. So I'm going to hit my medication log on the right-hand side. Take the Tylenol, set timings. We'll say it was 3 times a day. We'll say 10 a.m., 2 p.m., 6 p.m. Or you could say, nope, we're just going to do this PRN. Starting today through a 90-day program. I will say 30-day. Transfer. Put some as PRN. Hit close. And transfer. Always remember to hit the bottom right button. So this should now have Lori C. Should have Tylenol added. So I'm going to go home and go back to her dispensing board. Pick Lori. You'll see here's all the prescribed meds based on time, or all the meds with a timing set. Here's our PRN meds right underneath. It's the Tylenol 500 milligram. Select PRN. Patient took. With food. Pain is 6 on scale of 1 to 10. Sign it. Patient sign it. Transfer. You want to move on to your next task. Go home. Okay. End of the day, if you want to review your encounters, what I would do to see everything I did for the day, open your left-hand navigation bar, go to My Encounters. It'll allow you to search by your provider. It will default for you, whatever your username and login is. And let's say I just want to see everything I did from yesterday through today to make sure all my encounters are signed. You can also say, show me just unsigned encounters, signed encounters. You also can pick certain encounters that you want to see. So if I just want to see medical encounters that I did, for example, yesterday and today, I'm just going to search. So let's do it. Let's do all of these so I can see all of these. There we go. Okay. So you'll see here we have 1 signed encounter. We have 1, 2, 3, 4, 5, 6, and it scrolls down. All of these are unsigned encounters because they're orange. So if I wanted to bulk sign these quickly, you could check them all and hit bulk sign under the My Encounters. Or you can review each one first. So you can click the little orange button. It'll open up the encounter. You can make sure that you feel it's complete before you actually do the signature. And what it does is it just pops them up on the screen here. So I'll pick up one that's a little more detailed so you can see what it'll look like. Okay. So here's the medical encounter. Close it. I'm going to say let's bulk sign all of these. Bulk sign. Signs my name and hit OK. Now if I just want to filter and see all my signed encounters, now it gets rid of the unsigned. If I want to see just my unsigned encounters, I still have 3 that I didn't sign. Okay? I can open it up. I can look at it. I can say sign it. So any work you do is always sitting in My Encounters. That's step 1 or process 1 for finding a patient, opening a clinical note, completing the clinical note, signing it, adding current allergies and meds, attaching it to the dispensing board, and dispensing it. Okay? So the other way that you can do this, and we're going to start, is we're going to do the exact same thing, but you also can do it from something called patient programs. And we've gone through this a couple times, but whether you do anything from the bedboard or patient programs still takes you to the exact same place. Patient programs is new in the cloud. A lot of clients really seem to like it to review a lot of things quickly. So I'm going to show you the same thing and just kind of show you 2 different ways to do it. Ultimately, you can just continue to do it the way you do it today, or you can use patient programs. Okay? So if I want to use a client, let's just say I have to do some work on Jim Majors, just because I see him sitting right here, but I don't know where he is because I have 800 admitted patients on this patient program. Let's just find anybody, last name Major, first name Jim, but let's spell it M-A-J and first letter J. Okay, we have Jim Majors. I can see he's in adolescent outpatient. If I click on his face, it shows me his timeline. So I can see I did a medication encounter, a couple of them. Here are all the medication encounters, and then here's one progress note. So if I want to ever review them, I could review what was done. I could open up the med log and add an additional current med or add a standing order. So I'm just going to add a current med. And we'll just stick with something easy, the Tylenol. 500 milligrams. PRN, save, back pain. Okay, so I have that Tylenol. I'm going to put that on the set timings. Again, I'm doing the same thing. I'm just doing it from patient programs. And we'll say he's going to be here. We'll do it at 12. Oh, no, we'll do it PRN because you guys do a lot of PRN. So hit save. Creates the PRN. It'll now be in his, sorry, I should have turned that off. The Tylenol is now sent to the dispensing board, okay, directly from the medication log. If I then want to search a couple clients, let's say just in my residential program, I just have to do some work in there. Let's just say I want to see everybody in residential. Let's take out his name. Here are all my residential clients at a certain location, for example. I could click on Alex, see what we've done. We haven't done any encounters. We've just put him into a program, into a bed, and put his demographics into the system. If we take Ronald, we put him into the system, attached him to residential. We did a medication encounter, which we'll take a look at. Okay, good. And we'll take me, James Woods. We've done a lot on James Woods. He's been here quite a bit longer than other people. Okay, I can see he's in a certain program. I can see his admit and discharge dates. I can see emergency contact information by clicking on the top. And then I can just open up any note if I would like. So I can see anything that we've done. If I want to put a medication in, click the medication log. Add current meds if you want to use the little timeline. If I just want to go into their account, okay, I could take Alex Crispin, click any of the links at the bottom. He's a converted client. I can't use him for your training, sorry. I keep forgetting that. We'll stick with good old Lori. Go to patient programs. Find a client. We'll say her first name is L-A-U, I think it was. We have Lori C. Click on her face. You can see the documents that have been done. We can look at that medication encounter we did earlier. Hit close. If I want to do any work from patient programs, you just click the link at the bottom. It will take you into the chart. Same way we got there from the bed board, we're just doing it from patient programs. Hit the All tab. Hit the medical encounter, the plus sign, and hit save. Same thing, you can do it either way, and you can do it directly from patient programs, or you can do it directly from the bed board. Okay, so I'm going to stop there for a second, ask you guys if you have any chat questions. We'll go into a few other things, but I want to see if you guys have any questions on what we're going through so far. Okay, this time we're going to go through it, John. I'm going to start the recording and just go through everything we went through again. It'll be a shorter 20-minute recording, and then if there's no questions, I think we'll be done with that session. Sound good?
Sounds good to me.
All right, so I'm going to put the record on now, and we're just going to go through the same thing.
This conference will now be recorded.
All right. First thing that we're going to do is we're going to log into the application. Always hit your yellow button to make sure that it connects you to your database. You're going to put your username and password in. Same as version 7. You will not need the second authentication factor that I am putting in. And we'll go into your EMR. When you open up the EMR, we can default the screen. So if you primarily work in dispensing or bed board, you can have your screen defaulted to whatever your favorite preferred view is. At the end of the day, it's just one click to get where you want to start your day. Left-hand side of the screen is basically everything you do in version 7, okay, for Doc Assist. Everything at the top up here for the AD-S&P is Medix Premier. Okay, so if you want to put a new demographic in, you want to review demographics in Medix Premier, all you would do is access Medix Premier from the top right. In order to find a patient, easiest thing to do, you can go to the bed board or patient programs, and you will look for a client that you want to do work on. I'm going to stick with a client, Lori, today, Lori C. We're going to select her from the bed board. I can dispense medications directly from here, or I can use the dispensing board, which we'll go through both. In order, when you select a client, most commonly you're going to either add an encounter, which is add notes, or dispense meds, which is medication dispensing right from the bottom tab. First thing we're going to do is, assuming we have not done any work on this client, we're going to either do a medical encounter, we did a urine screening, and we need to put the results in. Those are the two that we're going to go through first. When you log into the client's chart, the right-hand side will give you the timeline. The timeline shows you everything that's ever been done on the client and gives you quick access to their medication history as well as any previous encounters that were done. So for example, if we did a medication encounter on this client earlier today and you want to review it, just click the little green button. It'll pull up previous encounters and you can review them on the screen. If you want to do a new encounter, click your All button. These are all the encounters we moved over from your current version. And what we'll start with is a medical encounter, for example. In order to open an encounter, you select the encounter and hit the plus sign, okay? So any encounter, select it, hit the plus sign. You can also add medications or current meds directly from the blue icon on the right, which is our medication log. You can see everything that's on the patient's chart currently, or you could add in current meds from here. So you could put in a current med directly from the med log. You can put in allergies directly from the med log. It will create it as part of the encounter you have opened, or you can do it directly in the encounter screen. Let me just move the GoToMeeting a little bit there. Okay, so what we'll do is we'll just start with a new encounter and we'll open one. Okay, when you do a new encounter, the first thing that you want to do is you want to hit your blue plus sign on the right-hand side. So that's kind of where we always want to start, is the blue plus sign on the right-hand side to do a new encounter. So I selected, let's do a medication encounter. Below, it will show you the encounter that was done. I'm just going to minimize the screen to make it more. So this is the previous encounter that was done. If we want to do a new encounter, you'll see here we did 199 at 10:47 a.m. This is the one that's already been done. If you want to do a new encounter, hit your plus sign. Okay, we'll just hit the save button. It's just validating who the counselor or nurse is that is actually doing the session note. And you can start a new encounter directly from the screen. Now, when we do these encounters, you can do it from patient programs or from the bedboard. Okay? So what we're going to do in here is, let me just find one that I can use because you have a couple that are the same. See if one will open for us here. Let's change the location here. See if that will work. Okay. Let's go home and try a different one. So let's see if I have a couple of them sitting here. Residential beds, Phoenix Hall. Add notes. Hit the all button. Go to our medical encounter. Hit our plus sign. Change it to Phoenix Hall. Admit. Pre-plan. All right, John, I'm going to move on from there and just try to find a client that we can do. I'll just re-record this for you and send it to you. So I'm just going to actually put a new client in quick. All right, Linda Woods. Go to our bedboard. Let's find a bed that's available. Let's try Phoenix West. Knitted. Woods. Linda Woods was the one we just put in. Put her in a program. Residential. High intensity. Save. Okay. Okay, so we'll take Linda Woods, add notes, go to the all button, select our medical encounter, the plus sign, much better. When you open the encounter, you can come to allergies and meds, whichever one you're opening. Add a current med. We'll just say it's 3 times a day, and it's we'll do lovastatin. Hit save. Add the allergy. Hit save. Transfer. Okay. Come down to our diagnosis section. I'm going to open up the left-hand side so I don't have to scroll everywhere. Allow me to add my ICDs, my CPTs, and my standing orders. So we'll say the diagnosis code. I'll just click the ICD code here. Let's just say whatever the diagnosis code is. Add to list. And then we'll pick our standing order. Hit the plus sign. Add a standing order. We'll select the standing order. Select all. Transfer. So now what I've done is I've added my diagnosis, I've added my standing order set, and I've added current medications that they came in for. Only thing I have to do is that I have to now execute them to send them when do I want them to start on the bed board. So I'm just going to hit the transfer button, the bottom right, say I'm done with the encounter. I will sign the encounter by clicking the unsigned button and just hit OK because I want to stay in the chart and do some additional work with the medications. Now what I will do once that note is saved is I'm going to go into the medication log on the right-hand side, and I'm going to execute all those medications to send it to the nursing board. Okay. First thing I'm going to do is I'm going to say the lovastatin we're going to give in the morning with breakfast, 9 a.m. starting today, ending a month from now, so we'll go to the 16th of next month, save. Creates that standing order and close. Then I'm going to take the standing order that was previously selected. Here's the standing order, all set at PRN, and I'm going to execute. Okay. All those medications now have been executed. Remember to hit your transfer button, so it transfers it all into the chart for the client. And now my document is signed, everything's available on the left. I can come home, open up my left-hand navigation bar, go to my dispensing board. Okay. Linda Woods is now expected to get a medication. Here's the lovastatin. Complete the order, and you're done. Okay. I'm going to go home. Now go to patient programs, because now Linda's in a program. I have her in a bed, so I should be able to find her in my patient programs if I just want to quickly go in and search for her. So we'll look for L. Woods. Take Lisa Woods. I click, Linda Woods. Lisa's my wife. Here's all of her demographic information, level of care, date admitted at the top. Here's her emergency contact information. Here's the medical encounter that we've done. Just click and look at it. Okay. From here, in order to access the client's chart, once I review, I basically would just go from here, click the bottom link under her silhouette, and now I can do any type of encounter or note or assessment that I want. The second part, which has now been added, is the ability to do the urine drug screen results if you're doing dip tests and cup tests. So I believe we added that into your flow sheets, but let's take a look at that and we'll kind of talk about the different things that we've done. So I'm going to go to flow sheets. These are all your pre-screening assessments, PHQ-9, MAST, GAST, Columbia suicide risk, anything that was done that you're assessing the severity of the problem or the result of something is all in your what we call our flow sheets in the cloud version. Okay, so everything we have here is all of our screening assessments. All right, so I don't see your urine drug screen loaded there. So what I'm going to do is I'm going to come over to the right-hand side, and there's a button called your in-house labs, where a lot of times we put them into clients for that. Okay, you'll see here, here's all your screening results, anything that you're screening. So what I'm going to do is I'm going to pick your urine screening. This is the one that I believe they added for you. So we're going to do positive for amphetamines, positive for benzone, and then we'll do negative for the opiates, PDT, and any of the barbiturates. And then we'll save that. Okay. Let me put the date in when we did this, which is today. Okay. So my urine drug screenings that you have in version 7 currently are sitting on the right-hand side under in-house labs. All right. Then what you can do is just click the little button here at the bottom, which is the stethoscope, which takes you to the last screen you were working on, and it takes you right back into the chart of Linda Woods. Again, I can do all of this work either from the bedboard or from patient programs. Bed manager and patient programs all take you to the same spot. It's just where do you prefer to work. Within the bedboard, we have kept both views, so the top right little checker box icon will take you to what a lot of our clients use in version 7 for the bedboard. Again, anything you're doing in a client's chart can be accessed the same way we showed you in the graphical view of the bedboard. I can come into what we call the grid view here, and you can open up and go into a chart the same way. So if I want to add notes, just like we did in the other bedboard, just select Add Notes, and it'll open up the client's chart. So really, at the end of the day, you can open up a client's chart from patient programs or the bedboard. They all take you to the same spot. In order to do an encounter, just open up your all. Everything that we've converted from your current version sits as an encounter under the All tab. Okay? The medication log sits at the right-hand side of the screen. You can add current meds, you can order meds, and execute your standing orders. If you want to do a urine drug screen, you will open up your right-hand navigation bar, scroll down to your lab results. Okay? You'll see your urine drug screen here, and I understand we're going to be cleaning out the rest of these that come defaulted. We'll put our date in and save. Urine drug screen added. Okay. When we're done, we can go home. If you ever want to go back into the client's chart, you left the client's chart to do a urine drug screen, you had to jump home to look at another client on the dispensing board, the system will give you two options. The bottom right has a little stethoscope. It'll always hold the last patient that you left their chart, assuming you may have had to jump out to take a call or do something quick. You don't remember who that last client was. The little stethoscope at the bottom will always just take you right back to where you were working in the last client you were in. Okay? If you want to see a list of current clients or most recently accessed clients, you can't remember which client it is, up at the top we have this little pick list drop down, and if you just go to recently viewed clients or patients, it'll show you everybody, at least for this training, that we went through today. So we were in Elizabeth, we created Linda, we put meds on Lori. James we tried to access, but he was a migrated client from your old system, so I couldn't access it. So if I want to go back into Linda's chart, I can click on it and then just jump into her chart. General navigation, and then I can start to do work. Okay. John, should I stop the recording at this point, and then we can just talk for a few minutes?